You know, folks, the internet is full of information regarding tips for proper oral care, but all too often this information is either misleading or just flat out wrong. I'll set the record straight in today's video. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the US. So time and time again, patients would say to me, "Hey doc, I read in a magazine that we should fill in the blank, or we should never fill in the blank. Is that true?" So today, I thought it would be a good idea to go over several of the more popular myths and misconceptions that I came across online. And let's just see how many of them you might have bought into. Okay, let's begin. Myth number 1, white teeth are healthy teeth. Well, this is not true. White teeth are not always healthier teeth. Although teeth start out white, over time they can get stained from coffee, wine, or tobacco. And the aging process will often cause the enamel to get thinner, allowing more of the yellow layer beneath the enamel to show through. Yet the nerve of the tooth can still be quite healthy. Myth number 2, sugar causes cavities. This one is also false. Although sugar does contribute to the formation of cavities, it's not the sugar itself that causes the problem. Rather, it's the bacteria in our mouths that eat the sugar. Bacteria gets attracted to the sticky, sugary foods that we eat and in turn produce an acid that ultimately causes the tooth to decay. So by keeping your mouth clean, you reduce the sugar and reduce the chances for cavities. This one was kind of tricky, I'll admit. Myth number 3, brushing harder cleans better. Now this one's gotta be true, right? I mean, you use more elbow grease to get stubborn stains off of other things, so why not your teeth? Wrong. Brushing harder is actually counterproductive. The harder you brush, the more trauma your teeth and gums endure. You can even cause your gums to recede, so stick to a soft bristled brush and take it easy. A proper technique beats the elbow grease every time. Myth number 4, bleeding gums are normal. Oh, this is a sore subject for me. Check out my video on gum disease up here to hear me rant about this one. Ladies and gentlemen, this one is false, false, false. Blood is supposed to stay on the inside. Bleeding gums are a sign of inflammation, and it's your body's way of warning you that something is not right. This is not normal. Okay, I'm done. Myth number 5, flossing is not necessary. Well, given the fact that 1 in 5 Americans never floss, and only 40% of those individuals who do floss do so on a daily basis, then you might be hesitant on this one. However, if you go to your dentist regularly, then your hygienist makes it very clear that this one is also false. Not only can floss reach areas that the bristles of your toothbrush can't, but studies indicate that flossing can remove up to 80% of plaque, which was the main cause of tooth decay. You gotta floss, people. Myth number 6, chewing gum works like brushing. Now, if you thought this one was true, I'm actually going to give you half credit, because in a pinch, chewing gum does promote an increase in the flow of saliva, which helps wash our teeth and kill bacteria, and it can help freshen our breath. But as a replacement for brushing our teeth, no. Myth number 7, kids don't need to brush baby teeth. Actually, your children should be taught to start brushing as soon as they have teeth. Not only does this establish a healthy habit for later in life, but don't forget that in time, their permanent teeth will start developing right underneath these baby teeth. Any infection with baby teeth can affect the development of permanent teeth and lead to problems later in life. And let's finish up with myth number 8. If you have no oral health concerns, then there's no need for an exam. Again, not so fast. We don't want to wait for a problem to develop before we address it, do we? An exam is a proactive way to detect any issues before they start. If we let things go unnoticed or undetected for too long, the solutions become more complex and costly. keep up with your dental exams. Well, how did you do? How many of these myths had you heard before, and how many did you think were true? Don't worry if you didn't score too well. Your dentist and hygienist will be glad to guide you through these and other myths and misconceptions as they continue to make your dental health their top priority. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.